Good morning. Today I'm joined by Dr. Kathy Lofi, who will have some comments about our continuing efforts against COVID, and she'll also stand for questions. This morning, we would like to give Washingtonians the highest confidence that when a COVID-19 vaccine is available, that it's safe and works. So today, we are pleased to announce that we are joining a Western States Pact partnership on reviewing the safety and efficacy of COVID-19 vaccines when they are approved by the FDA. This will be an added layer of assurance and of an expert review that will help Washingtonians and others in Western states have greater faith and greater confidence in the vaccine so that we can increase the number of folks who actually get the vaccination. And of course, that's imperative if, in fact, we are going to beat this pandemic. This panel of experts, it was started by Gavin Newsom of California. We appreciate his leadership on this. It will include experts appointed by other member states, including our own, and it will be made up of nationally recognized scientists with expertise in immunizations and public health, and so it will bring an additional level of scrutiny to this process. Now, luckily, as people have expressed growing concerns about the potential political impacts on the process, the FDA published information about the data required for authorizing a vaccine. That, combined with two independent federal groups in our own Western states review process, should give the public high confidence at the end of the day on the safety and efficacy of a COVID-19 vaccine. Now, obviously, we know that cannot be guaranteed that there will be an approval, but we do have now and will have high confidence in the process, assuming that there is an approval. This panel will review all publicly available data concurrently with federal reviews and will present a report as soon as possible after the FDA approves a vaccine. Now, we're hopeful that more than one vaccine will be approved, and this panel will review the safety and efficacy of each one. We know how important this is. When a safe vaccine is available, our state is going to be ready to distribute it in a way that is as equitable and efficient and safely as humanly possible. Now, as we're talking about the vaccine, we have a current challenge before that happens. And we've had some distressing news out of the White House recently. The fact is that the White House is essentially almost checked out of this fight now. The White House Chief of Staff said that they're not going to control this virus. Well, I'm here to say that Washington State has not given up in controlling this virus. We are not ceasing our efforts to control it. The white flag of surrender to this virus is not flying over our state capital in Olympia, Washington. We are committed to fight and defeat this virus, and we are committed to doing the things that allow us to do that today, even before a vaccine arrives on the scene. We hope that will be as soon as possible. But every single day, we have the capability of saving lives in our state, and we are committed to saving lives in our state today. Not just tomorrow, not just in November or December. And so I want to make sure that people understand that, because we should be proud of what Washingtonians are doing today. And I am proud of what Washingtonians are doing today. We're masking up. We're social distancing. As a result, we're having relative success. And we feel the pain of the other states that have so much more activity than we do. There are some states that have 10 times more infections than we do per capita. 45 other states, last I checked, had more infection rates than we did. The cases continue to rise around the nation, and we just want to assure people that what we are doing does have an impact. We have saved thousands of lives in the state of Washington already. We have the capability of saving thousands of more lives even before this vaccine arrives on the scene. And we're committed to that today. We know the things we're doing are working, Other states that do not have mask requirements, like Idaho, unfortunately are experiencing the devastating results of this pandemic. Last week we were told there were some hospitals that may be sending patients to Washington or Oregon hospitals because they're running out of room. We hope that they can find a way to reduce these infections. We commend to them the things we're doing, including wearing masks that we know that have reduced our numbers and saved lives. We hope more places in the United States follow our leadership in this regard. So our office, joined by millions of Washingtons, continue to fight this pandemic while still mitigating its impact on the economy. And we've been fortunate to be able to open up quite a number of new businesses in the last month or two. But this virus persists, and it should be abundantly clear that we do not have any intention to allow this to take over our state. So we've established some rigorous but appropriate restrictions that have been effective against this virus, and we've turned the dial significantly. But we know we've had some increasing activity recently in our state. That means we need to keep being careful and keep wearing masks. We know we need to continue to limit our interactions with others. And here's one thing that I think is to some degree new in our state. We're doing some great work when we go shopping, when we go out, when we go to work. But we need to add to those efforts, our efforts at home. When people come to our home where infections can take place. We simply need to stay socially distanced and wear masks, even in our homes, if we're really going to keep this virus from bouncing back. And that's kind of tough because, you know, we feel safe in our homes. It seems we're secure. We let our guard down. But this virus can sneak up on us right in our own homes. To talk about that and the importance of wearing masks and what the benefits are, I'd like to Dr. Lofi to make some comments. Kathy.
Great. Well, thank you, Governor, and good morning, everyone. I do want to just take a minute or two to re-emphasize the importance of always wearing a mask when you're around anyone who's not a member of your household. We continue to emphasize the use of facial coverings because this really simple intervention can save lives. I don't know how closely many of you are following the University of Washington Institute of Health Metrics and Evaluation website, but the University of Washington Institute of Health Metrics and Evaluation has put together some projections on the number of deaths that we might experience here in Washington State this fall and winter. And their analysis shows that we could prevent about 1,000 deaths by February 1st if we increase mask use in Washington to 95%. So it's pretty amazing to think about that we have this really simple intervention that could prevent hundreds of deaths this winter if we all do it. I also want to share some new research from Dr. Bennett from Western Washington University. He surveyed about 4,000 people from Northwest Washington and learned that while over 90% reported often or always wearing a mask in public, only about 50% of these same people reported often or always wearing a mask in private settings. And those numbers were a little bit variable by age group. Younger adults were less likely to wear masks in private settings than people who were older. Some common reasons that were reported in the study for not wearing a mask included the fact that people didn't feel like they could get infected. And then people also reported commonly that it just felt unnatural to wear a mask when you have, a good friend over in your house. And I think everybody can relate to these data, including myself. I do think, some people may feel it is awkward to ask a friend to wear a mask when they come over to your house. But we really need to make mask wearing, particularly inside, always with people outside of your household. Really, we need to make this the norm this fall and this winter. In addition to masking, I just want to remind people that good ventilation is also extremely important for reducing the risk of COVID-19 transmission. And we need to continue to do as much as possible outdoors. And if you are indoors or if you're riding in a car with someone, roll the windows down so you have more air that is circulating. I think the bottom line is that we'll be able to do more this fall and winter if we do things safely. So with that, Governor, I'll turn it back over to you.
Thank you, Dr. Lofi. Appreciate your work. I think the interesting thing about this is that we ought to realize how powerful we are in the state of Washington and how we respond to science in our state and how we're capable of really stepping up to the plate. You know, we weren't wearing masks a year ago, right? So that would be pretty unusual for any of us to wear a mask when we went to the grocery store a year ago. And yet you jumpstart a year and, 95% of us are wearing masks. And we're still shopping and we're still talking to people and we're still enjoying life. We can do that while we wear a mask. And it just shows you how we're capable in our state of embracing common sense things that are based on science. Other states have not been able to do this. The reason I mention this is I think now that ought to give us confidence we can do the same thing in our private settings, in our social settings, even in our own homes. We know what we're capable of doing. We have done it outside of our homes, and we ought to be able to do it inside of our homes as well, because that's where the new battleground is. We're now fighting that. Others are losing that battle. We do not intend to lose that battle. We intend to stick with science and save as many lives as possible. And it's kind of a cool thing that you can save somebody's life in your own living room by showing some safety measures. So we hope people will think about this in the upcoming weeks. I'd like to comment on our most precious right, besides saving lives, and that's to vote. We're 1 week out, and you should have received your ballot by now. So regardless who you are voting for, we need you to turn in your ballot. We need your voice. We need every voice in our state. Our state does better when every voice is heard. And I hope everyone will make sure that has happened. We have some good news. As of yesterday, 2,252,759 votes have been received already. This is 46.6% of the registered voters in the state. That's over double the amount of votes that had been received at this time in 2016. So we know we can vote by mail, something that's been done successfully in this state for more than 10 years. Now here's what's important about voting by mail, though. If you do choose to vote by mail, you really need to get that ballot in the mail as soon as possible. It would be great if everyone could have their ballot in the mail who are going to use the mails by this Friday. Even better, you can turn your ballot in at a drop box or a voting center. That's one way to make sure it is delivered. But the sooner the better. I just can't repeat how important that is given some of the uncertainties that we have experienced. If you aren't registered to vote, you can do that in person at your local elections office through Election Day next Tuesday. And you can locate your nearest elections office by visiting votewa.gov, votewa.gov. So we'll look forward to people getting those ballots in as soon as humanly possible. Lastly, before we take questions, we had another extraordinary event in our state. Our congratulations go out today to the really innovative people at the Washington State Department of Agriculture for finding and eradicating the first Asian giant hornet nest in the United States. It's of course not the best news to discover we're the first place to have a nest, but it is great news that we have such creative entrepreneurial people at the Department of Ag that tracked down this nest. It's pretty amazing the techniques that they used. We know this is a dangerous invasive species that prey on honeybees and other insects. We know how important honeybees are to our ag industry, to our very sustenance. And so, in fact, a small group of these hornets can kill an entire honeybee hive in a matter of hours. So our Department of Agriculture and some intrepid volunteers have spent nearly a year trying to track down this nest. And on Saturday, they eliminated this nest, keeping some hornets for research so that we can better understand their life cycle. This is great news. I want to thank them for their hard work and their innovative techniques that they use. We're a very innovative state. We do software well, and we do tracking down hornets really well, so congratulations. Last note, we have for us in our office a sad piece of news that Jan Kuahara, who's been filming these events for Cairo 7 throughout our conferences with great skill and perseverance. Jan, thank you for being part of this effort, for sharing with the public. You have worn your mask with great distinction, and I know the public appreciates your work. So good luck.
Thank you, sir.
Okay, happy to stand for questions.
With that, we'll go to Rachel from AP. Go ahead, Rachel.
Governor, related to the vaccine review pact, other than California, which other states are involved? And is this a binding agreement that there will be no vaccine availability in those states until there's a multi-state sign-off, even if other states start distribution earlier?
Well, we anticipate there'll be one report, and I don't see a reason. I'm sorry. Yeah, so Washington, Oregon, California, Colorado, and Nevada are the states in the pact. So we anticipate there will be one report. And I will tell you, there's nothing that would suggest to me that there's a reason that, you know, different states would have different viewpoints. We all believe in the same laws of thermodynamics and chemistry, so I don't look forward to any interstate dispute in that regard. I do want to emphasize, too, that we are going to ask this group to concurrently review this data as it becomes available. So they'll start their work before the FDA makes a decision. And so I'm really happy to go down this route.
Rachel, did you want to ask a follow-up?
Yes. Do you know if the panel will also decide whether or not the vaccine should be mandatory in any instances?
There has been no discussion about mandating this vaccine. No one has proposed that. And so they will not be reviewing that issue because no one has proposed that.
All right, next we'll go to Joe Sullivan with the Seattle Times. Go ahead, Joe. Joe, are you there?
Yeah, can you hear me now?
Yes, Joe, go ahead.
Governor, back in April, you announced a sort of pact with California and Oregon to coordinate the reopening of economies. We never heard much more out of that after it happened. What sort of coordination actually occurred between the states, and what do you credit to that pact?
Well, you know, there's been a lot of work behind the scenes with our West Coast states. I think it was much more of an informal success than a formal one, but it has been successful. I looked at Oregon, Washington, and California's numbers this morning, and I think 42 states had more infections than California, 44 states had more infections than Oregon, I think 45 had more infections than Washington. I may have Oregon and Washington mixed up. We sort of trade positions on this. So I can tell you that sharing the information has been valuable to look what seems to have worked, masks, and that has gone on very frequently. So I would consider that a success. We didn't bother by formalizing that on our decision making, but it's worked because the West Coast is leading the nation, and we were the first hit, obviously. Washington State was the first hit and hardest hit. And again, I take pride in our state and the West Coast states in leading the nation, keeping this pandemic down. So I'm really appreciative working with governors of Oregon and California.
Joe, did you want to ask a follow-up?
Yeah, given that there could be substantial resistance to a vaccine, at least among some segments of society, how optimistic are you that a vaccine distribution will actually be able to end the pandemic?
Well, I would describe myself as cautiously optimistic because we're seeing some relatively promising results from some of these trials. We've also seen success, apparent success in following the rigorous protocols of safety and efficacy. Actually, when they've stopped a couple of these trials because they've had some potential adverse events, that's a good sign because it's shown that the process is working, that it's not just going to be a rubber stamp. So that's good news. There's been some sort of fundamental results of showing immune responses. I feel that the public will largely be accepting of this because they understand how fatal this disease is. They've seen it, and we want to get our economy back. And the fastest way we can get our economy fully back, we've done some great things lately. We've opened up some restaurant activity, bowling alleys, agribusiness, more activities in our places of worship. But we want to get back to as close to normal as we can, and that means if we get a vaccine to actually use it. So I believe we will succeed in getting large numbers of people, I would say the requisite number of people, to actually knock down this virus. So I would describe me as cautiously optimistic. But again, I want to reiterate, it's sort of like, we're rowing to the distant shore where the vaccine is going to be available. And somebody falls overboard. You just don't tell them, well, we'll see you when the vaccine shows up. We got to throw a life ring to people now. We can save lives today. So yes, we ought to be pleased about the progress of vaccines, but we can't wait for that. We got to save lives today. And the numbers Dr. Lofi was talking about, think about this. Think about a line of 1,000 people lined up on a sidewalk. And the knowledge that all of us, me, you, everybody, could save some of those folks, that's pretty extraordinary. And to think about what this has meant to our country. You remember our response on September 11th, over 2,000 Americans died. Now we've had over 200,000 die of this disease, and we united as a country and we took action. Now we're asking people to take action in their own homes to protect themselves and their loved ones. Even wear masks where there's people that are not in your household, even in your own home. That can be very effective. So I hope more of us do it.
All right. Next, we'll go to Hannah Scott with Cairo Radio. Go ahead, Hannah.
Hi, Governor. Will joining the Western Pact regarding this vaccine, is it expected to delay the availability of the vaccine in our state at all?
We anticipate that their work could be done in days after the FDA comes up with a conclusion. And the reason is the group will be looking at the data as it's coming in. So they'll be doing their review before the FDA announces a decision. And we think it would just be a matter of days it would need. So no significant delay whatsoever, because we know how pressing this need is. Now, having said that, people do have to realize that it's going to take time to manufacture enough doses of whatever vaccine is approved. And there will have to be prioritization. And everybody's going to be paddling as fast as they can on this. So I'm confident this will not delay the solution.
Hannah, did you want to ask a follow-up?
And this could be for the governor or Dr. Lofi. I'm wondering, given the ongoing rise in cases that we're seeing, do you feel that the current restrictions are working well enough when we deal with the pandemic?
Well, if I can, just tackle that just for a second. We believe that if we increase our use of masks and social distancing in social settings, that we can get on top of this virus. That's the challenge at the moment. And our legal restrictions really don't involve that. We don't restrict individual activity by and large in people's homes. But that's where the battle is being fought right now. So we have a good suite of decisions that simultaneously have been allowed us to open up some of our businesses while simultaneously keeping these numbers down on a relative basis better than 45 other states. That part of our efforts seem to be quite healthy and having good impact. But if people then go home and get infected when friends come over, and we don't wear masks, we don't socially distance, and we spend a couple hours, and then somebody, maybe 3 or 4 people get infected. That's the part that we believe that now requires more of our attention, because we think that's where a significant part of this transmission is taking place. So that's really our ability is one of encouragement largely in our individual lives, in our private lives, in our social lives in that regard. So it's going to depend on Washingtonians not wanting to see our state be in the situation like Idaho is in, where they have to start shipping people across the state lines in hospitals, or Wisconsin, where they've had to set up new hospitals, or Europe, where there have been large shutdowns of the economy because of these rising cases. So we believe that can be successful. Kathy, would you like to add to that?
No, I think you covered that pretty well.
All right, next we'll go to Jim Camden with the spokesman review. Go ahead, Jim.
Governor, if this Western states review of the vaccine greenlights the vaccine, would you support requiring students to get the coronavirus vaccine to be allowed to go to school?
We have not had any discussion about that. That has not been proposed. It is not part of the review process. So that is not something that is under consideration.
Jim, did you want to ask a follow-up?
Yes, on the election, have you tasked the National Guard with any kind of election security, either on election day or in the weeks afterwards, if there is some doubt as to who won the presidential election?
Well, they have been preparing for any potential disturbances. I haven't given them any specific direction, but I'm confident they've been working with our emergency responders, our state patrol, local officers. I do think that there are due consideration has been given to those possibilities. But if people will vote and get their ballots in the mail in the next few days, we won't have to worry about that. Hopefully we'll have some clear results.
All right, next we'll go to Jerry Cornfield with the Everett Herald. Go ahead, Jerry.
Governor, I was going to ask why you were not bringing back any restrictions today. I know last week you were asked, you'd said you'd have more to say about that in the coming days. So I'm just wondering, are you saying now that more restrictions on maybe some activities, social activities, public life will not flatten the curve anymore, that they're working and they don't need to be added to?
Well, I'm saying that, unfortunately, for those of you who have gone to these press conferences, the same thing I've been saying for months, which is that every single day we evaluate this situation. And every single day we look at the numbers and figure out, is there something we can do to help reopen our economy and knock down this virus? And I can't make any predictions. It's to speculate about the future is a fool's errand. What I can tell you is we have the plans in place today that make sense with our current situation, with a clear recognition that it is necessary, if we are going to prevent this virus coming back, for more of us to adopt good protocols in our own homes, in our own social settings. That is a requirement, but it's not a legal one. It's just a scientific one, and that's why I'm encouraging people to help us in this regard. And I feel good about our ability to do that because we've already demonstrated our ability to up our game against this virus. And we've demonstrated that better than, most all other states and many, many nations. So I believe as we continue to care about each other and come inside and realize we've got to think of some new ways of doing business in our homes, that we can succeed in this. But that's what we got to work on.
Jerry, did you want to ask a follow-up question?
A question for Dr. Lofi. The public health officials in Snohomish County are dealing with an outbreak of 50 cases at a long-term care facility. I want to know if you're aware of, if the Department of Health is involved and aware of and involved in trying to deal with that outbreak at this time. If so, could you tell us what's going on, what the state's role is?
Yeah, so generally the state's role in outbreak investigations is to provide technical assistance to our local health departments. So it's really our local health departments that are on the front line, that often go into the facility, evaluate what has happened, and give the facility advice around infection control practices and advice around who should be tested. The Department of Health provides technical assistance to the local health departments. And then we also sometimes do testing at our state public health lab, for the particular facility. And most of this work is done by our healthcare associated infections program. So that is generally the role of the state versus the local health departments. At this time, I, don't have any, additional details to share about this particular situation.
Yeah, we have had extremely rigorous protections around our folks in these long-term care facilities, extremely rigorous. And yet some of the virus can still get in. And one of the reasons is we have to have people work there. And these people don't live in the facility. They live outside of the facility. They have lives outside of the facility. And we test those folks and we take screening, but people can be asymptomatic and then come into the home and then infect people in the home, even despite your most rigorous hygiene. And the reason I'm noting this is it's, some folks think that we can just take vulnerable people and put them in a bottle and put a cork on the top of it and protect them until a vaccine shows up. That just isn't possible given the fact that we have people going in and out of these homes by necessity who care for them, nurses, engineers, and everybody else. So I do believe we're doing everything we can. We're going to continue to do that, but this comes back. If you want to save somebody in a long-term care facility, we can do that by being careful in our own homes with people who come visit us. And that's a good thing to be able to save a life.
All right, up next, we'll go to Megan Carroll.
By the way, to show you things, even the White House, they're starting to wear masks. This is a pretty amazing achievement. It only took 8 months for the White House to figure out that, gee, maybe this could be a bad disease. I think that's a wonderful thing. If they can figure it out in the White House finally, I think some of us can as well.
All right, up next, we'll go to Megan Carroll with Crime 2 News. Go ahead, Megan.
Hi, Governor and Dr. Lofi. I wanted to know, we have a significant amount of cases that are being reported in Spokane County right now, and they're climbing at a pretty rapid rate. Has the state considered any additional restrictions for our county? And possibly a question for Dr. Lofi, what are specific areas or sectors that are of concern here right now?
Kathy, do you want to answer that?
Sure. I mean, to answer your first question, as the governor stated, we're constantly reevaluating, the data that we're seeing and the approach that we're taking. So, with the goal of trying to, mitigate disease transmission, keep our economy open, and really get our kids back in school, which is still something that we're really, concerned about. So, we are continually discussing, kind of the path forward and what that may look like. In terms of, I think your second question was about specific areas of concern in Spokane County or as a state as a whole?
In Spokane County.
Okay. Yeah, unfortunately, I can't speak to that today. The best source of information for you is really the Spokane County the health department. They would be able to give you the best information about what exactly, is the biggest concerns in Spokane County at this particular time.
I can share a concern that I have, which is that the folks in Idaho are experiencing infection rates, I think 5 or 6 times higher than the state of Washington. We grieve for them and the families that have had losses in Idaho. And they have explored sending patients to our state. I talked to a nurse in Portland last weekend who said that they had already had patients that had been shipped to Portland from Idaho. A nurse told me that. I haven't confirmed that with the hospital, so take that with a grain of salt. But at the same time, they're considering having to ship patients across the whole state. I'm advised the Kootenai County commissioners removed a mask mandate. Now, that is very troublesome to me that a state right across our border that we share a real long border with, people going back and forth constantly, instead of increasing the common sense measures that we know works to reduce the pandemic, they went backwards and removed the mask mandate. One of the people voted right. I read a comment, said he just didn't believe, COVID was real. I mean, what planet are people living on? We've had 220,000 people dead in our country. And Kootenai County is removing a mask mandate while they're shipping us their patients? I'm concerned about that. And I'm very hopeful that our wonderful folks in Idaho will join us on being responsible about this fatal disease. We will continue to help them in our hospitals. Their losses are ours, but we sure could use some help.
Megan, did you want to ask a follow-up question?
Yeah, Governor, a quick follow-up. Have you heard of any patients from Kootenai County in Idaho that have been transferred to Washington, or just anecdotally Portland at this point?
The latter, and I have not surveilled the hospitals to see if we actually received any patients or not. We would love those numbers to come down in Idaho through some kind of miracle, but just betting on a miracle right now when a piece of cloth works, we hope they'll reconsider this.
All right, next we'll go to Alexis Crowell with the Tacoma News Tribune. Go ahead, Alexis.
Yeah, by the way, I want to add something. Excuse me if this is an important issue, so I want to talk about it just for a minute. A piece of cloth is not a political affiliation. It's a piece of cloth. Everybody can wear a piece of cloth. Doesn't matter what party you're in, religion, or anything else. Number one. Number two, it does not prevent people from doing virtually anything they want to do anyway, except eat or drink. All of our businesses can operate, virtually all of our businesses, while wearing masks. It doesn't intrude. And I think it's important to distinguish wearing a mask from not being able to do your business. We now can do virtually all of our business. A mask does not intrude in our ability to accomplish the things that we have to do, including socialize. And so there's just no reason not to do it, frankly. Jen and I have had a very great working relationship. We've both been wearing masks for several months. He's doing his job, I'm doing my job. And that's why we hope Idaho will reconsider this.
All right, up next we've got Alexis Crowell with the Tacoma News Tribune. Alexis, go ahead.
Thank you. I'm wondering what sort of demand or participation drive-through or walk-up flu shot clinics in the state are getting, and if potential mobile clinics for a coronavirus vaccine would run similarly in Washington.
Kathy, would you like to address that?
Yeah, so I can report that the uptake of flu vaccine looks like it's going to be very good this year. We've been looking at our data every week, and if I remember correctly, I think in September, there were flu vaccine that had been delivered to adults was about 18% higher than had been delivered in September of last year. So that's really good news. So we're really excited that people are, listening to our messages and going out and, getting their flu vaccine. It's really the best thing that people can do to prevent the flu this particular winter. In terms of mobile clinics, we are working with our local health departments to think about ways that we can, give the coronavirus vaccine. And I think that's what you're referring to with mobile clinics. There's probably going to be a variety of different ways that the vaccine may be potentially distributed on the ground. We're working with our pharmacies, we're working with clinics, the traditional places where people get flu vaccine. But, I've also heard that, some other localities may be thinking about some sort of, a drive-through way to get a COVID vaccine as well. So more to come as our planning matures.
Right. Alexis, did you want to ask a follow-up question?
No, thank you.
All right. Up next, we'll go to Mayor Kawash with KXLY. Go ahead, Mayor.
Good morning, Governor. Just based off your comments about Idaho and the rising infections here in Spokane, is there any consideration to maybe forcing a quarantine for people who cross state borders, and is that even enforceable?
We have not actively considered that as an option, at least at the moment. The interchange between the two states on a daily basis is so profound, it'd be very difficult for people in so many different ways. So we have not actively considered that. Now, obviously, you can't rule that out in the future, given what other circumstances, but as of now, it has not been seriously considered. And by the way, I want to, I've said some things to try to encourage Idaho in a direction to join us on this. And I don't want to sound too judgmental, but in a sense I am, because it affects my folks. I represent 7 million Washingtonians. And what Idaho is doing or not doing has a profound effect on the people, certainly in Spokane County's health. And it's at risk right now. We've seen ups and downs in Spokane County. But every death in Spokane County, thinking it might have come from Idaho, when Idaho is not joining us in wearing masks, that's very painful to me. So I do hope over time that Idaho can consider this over time and join us. We know that can happen. As I've said, we've even got the White House wearing masks now to some degree. If we can accomplish that, maybe we can accomplish it in Idaho.
Mayor, did you want to ask a follow-up question?
Yeah, just one more thing. We've seen some international studies from NPR and local studies that have suggested that COVID is not spreading as much in schools, rather it's coming into the schools from outside places. What are your thoughts on that? And can we see more students back in school soon because of it?
Well, we have seen the same research to indicate that there has been less in-school transmission than perhaps people have been concerned about. We're continuing to look at that literature, and we share it with school officials. As you know, we have made recommendations to school districts, but school districts and the school boards are making local decisions about how to do their education on-site or off-site. We have made a recommendation that at moderate levels, essentially schools do look at options for going back, particularly in the early grades. And we think that the literature supports that as being the right decision if you have only a moderate level of the infection. So we share that recommendation with local school boards. And again, this issue of, if we start wearing more masks at home, we can get more confidence of local school boards of opening up their schools, particularly to the early grades. We all understand how difficult it is for the early grades to be cut off from their educators on a personal basis. Extremely difficult for educators. Holding the attention of a 7-year-old is quite a challenge. Our educators have been doing their level best. They've been doing fantastic work to do that. But we'll continue to share the information we have with the local deciders on this.
Any more questions?
right, up next we've got.
Kathy, would you like to add anything to that?
No, I would just agree. We are, we're seeing the same data that you're all seeing and looking at it very closely. Really having lots of discussions currently around like kind of the best path forward here in Washington.
We know that people have been very concerned when in other places that have had on-site learning, when they have had a student with a positive test. But in assessing whether or not to open a school, we think it's really important to distinguish having a student with a positive test and having students or staff with positive tests where the transmission took place in the school. It is inevitable that there will be students who will become infected at home, then go to school, but that does not necessarily mean that the transmission took place in the school environment. And what the research is showing, I think, is that particularly in the younger grades, when social distancing and masking and really, really good hygiene has been used, that one can successfully do that without increasing in-school transmission. And that's really the thing that we've got to look at on that research.
Yeah, and I'll just also add that our requirements for safety measures to be taken in schools are very stringent, and we feel really good about them, and we really feel like they're the right measures that need the right measures that need to be in place to prevent transmission in the school setting.
Hey, we have had in-school education. We have not really seen in-school transmission that we can identify in those schools that have had on-site instruction to date of any significance. So we know this will continue to be a discussion with local communities, and we hope everybody looks at this research.
All right, up next, we'll go to Keith Eldridge with Como TV. Go ahead, Keith.
Governor, you're talking about your West Coast panel. Why not a national consortium with the potential that if your panel gives the green light, but the other national experts don't, what would that do to the confidence level of your vaccine?
I got to make sure I understand your hypothetical. Well, so far we're the only group that has a state review system that I know of. I'm not aware of any other states that have proposed, or maybe New York has. New York might have. So I'm not sure I understand your question.
I can try to answer it. I think I guess the first thing to understand is that it's really the FDA, that the FDA is the only entity in the country that's able to authorize a vaccine. So it's the FDA's decision as to whether the vaccine should be authorized and who the vaccine is authorized for. Because often they'll look at the clinical trial data and determine what populations were in the trial, and then approve the vaccine for certain populations, certain age groups. And then it's the Advisory Committee on Immunization Practices, which is an independent body that provides advice to the Centers for Disease Control, that decides really who should get the vaccine. So nationally, there are two independent bodies of experts, one that advises the FDA, one that advises the CDC on whether first the vaccine should be authorized for use, and second, who it should be used for. So, the state body will be, reviewing the evidence, and as the governor said, creating a report, really on the safety and the efficacy of the vaccine. Really on the safety and the efficacy of the vaccine.
So if the FDA does not approve the vaccine, our review panel will not be able to overturn the FDA decision, if that makes sense. So we can't, if the FDA does not approve the vaccine, we will not be able to approve it.
Keith, did you want to ask a follow-up question?
Yeah, Governor, should we be planning to be in this for the long term? That Dr. Chris Bitters, the health officer of Snohomish County, has just said that even with a vaccine, that we need to plan to be in the middle of this 9 months from now, even a year from now, because not everybody will have a vaccine, and that we need to be prepared. This is going to be another year.
Well, it probably doesn't really help us to try to figure out when the day I will get my vaccine. It probably doesn't help to burn a lot of energy trying to figure it out, because whenever that is, we'd be doing the same thing. What we should do today is get our ballots in the mail today or put them in a drop box. We should be figuring out how do we protect ourselves, not only when we're shopping and when we go to work, but in our own homes. And we're going to be doing the same things whether we were going to get the vaccine at Christmas or spring. We just should be doing what we should be doing. So I just don't think it helps to try to speculate a lot about that. But, I will say during the best case scenario, by the end of this year, we will only have a small percentage of the most at-risk people who, in the best case, will have available vaccines, maybe 5% by the end of this year. So this is a matter of months, but that should not make us despair or be joyous. We should just do what we can do, which is wear a mask and enjoy the people around us as much as we can. That's what we can do today.
All right, up next, we'll go to Lauren Donovan with Cairo 7. Go ahead, Lauren.
Hi there, Governor Inslee. So my question, first off, is to those who are perhaps supporting the Trump administration living here in Washington. How would you justify this decision that you're making of this new pact to those who might say this is purely political? Why should they?
Well, good question, important question. Life is not political. Life is all we've got. We've lost over 2,000 Washingtonians, and their deaths were not political. They were personal with their families and their brothers and sisters and their children who lost them. Republicans, Democrats, Independents, we all understand it. This is about health. It's about life, number one. Number two, if we get a vaccine, we want it to work. It doesn't do a lot good to have a vaccine approved by the FDA, but then it never achieves real immunity with sufficient degree to knock down this virus so we can fully open our economy. And in order to make the vaccine work, we have to have a requisite number or percentage of people actually use it. And if people don't trust the system, some people may not use it. And there have been some reasons that people have espoused that they're concerned about whether the system is actually credible or not. Some of that, unfortunately, has been caused by the sort of ham-handed attempts by the president to monkey with the FDA process. And that has caused people to increase concerns. The number of people who've expressed a willingness to take the vaccine has gone down 15 or 20% in the last several months, in large part because they've seen the president trying to tell everybody he has a vaccine by election day. That's most unfortunate. So we have to fight against that lack of confidence. So this is just a way, hopefully we have a vaccine as soon as possible, and we hope that within days, this review panel can confirm that the FDA followed the protocol, and we can get the vaccine and we can beat this virus. That's what we're about. And when we beat this virus, it's going to help Republicans, Democrats, and Independents of all stripes, and I'm looking forward to that.
Lauren, did you want to ask a follow-up question?
Yes. So, Governor Inslee, any estimate cost for this? Who is going to?
Could you excuse me just for a moment? I'm sorry. I do want to reiterate that so far, there's a lot of reason to be confident in the FDA process. They now have, in several occasions, demonstrated a willingness to stand up to the President of the United States. And that takes a little bit of courage to do that. And they have demonstrated that to date. They have refused the President's request to bend to his will and short-circuit this safety process. The manufacturers have also demonstrated a commitment to this process. One of the ways is they have made their data available publicly, or their protocols available publicly. They've never done this before. So they've all put their protocols out so we can all evaluate whether their protocols are sufficient or not. They've also stopped some of the trials when they've had an adverse event. This is a good sign because it says they're following the rules. So the point I want to make is the process is working to date. We want to give people added confidence about that at the end of the pipeline.
Lauren, did you want to ask a follow-up question?
Yeah, great thank you for that further clarification. So back to the other question though, any estimate cost for this? Who will be footing the bill?
Well, we will pay whatever is appropriate for our portion. We'll have a person we will have a representative or representatives on the panel. I presume that we'll have some reimbursement of them. I don't think it's going to be extraordinary.
Last question. All right. Last question will be Chris Daniels with King 5. Go ahead, Chris.
Yeah, hi, Governor. You had mentioned the record returns of ballots at this point, so many days away from the election. I'm curious if you credit the President Donald Trump with that response.
You know, I would like to avoid answering that question. You know, when you get to this point, maybe you just try to calm the waters a little bit, let people make their own decision. You probably know I do have an opinion about that, but I won't express it today and just hope people can make a good judgment, get their ballots in the mail. So thanks for the softball question, but I'm not swinging here, Chris.
Chris, did you have a follow-up question?
Yeah, and I just look for further clarity, Governor, on what you said about the election security and any sort of concerns bringing in the National Guard. So you're saying at this point that you do not have any current plan to bring in the National Guard to secure drop boxes and the security of the election?
Well, the National Guard has been considering these issues. They have a plan on how to respond to issues that could arise. I have not given them specific directions about how to do that, but people can rest assured there have been many discussions so that all of the security personnel in the state, including local police departments and sheriffs, are thinking about this, and I'm glad that they are. So far, we have been largely free of disturbances around voting, and that's just a really wonderful thing. Democracy is about voting, and we just hope that all of us respect our respective votes, no matter who we vote for, and we can all count the votes. If we can count the votes, democracy will do really well. No, thank you very much. Again, thank Jen. Good luck.